Injection, you need to be aware of certain landmarks. So I have drawn that for you. If you feel this is the superior border of the clavicle, this is inferior border of the clavicle, feel for the coracoid that is right in the front here. Then you feel for the anterior and posterior aspect of the acromion. So this is the anterior, this is the posterior aspect, this is the anterior aspect, this is the lateral border of the acromion which I have drawn. Now this is the spinous process and this is the shoulder. Now there are two approaches that we commonly use. One is the posterior approach that we go from the back, and the other approach is the lateral approach where we go from the lateral aspect. So let me talk about the posterior approach first because that is what I commonly use. So I will demonstrate you how to do the posterior approach first. So for doing the posterior approach, if you've seen doing shoulder arthroscopy, we talk about the soft spot. Now the soft spot is just a centimeter below this posterolateral border of the acromion. So feel for the acromion, feel for the spinous process. This is the posterolateral corner if I draw it here, and if it's just below it, you will feel the soft spot. So this is which will be the site of injection. So if I can just put a pointer here, roughly a centimeter below and inferior to the posterior border of the spinous process. Now the direction is also important. The reason we draw the coracoid in the front, coracoid is right here. Now your needle has to be directed in direction of the coracoid. You don't go straight, you don't go lateral, so you aim your needle going towards the coracoid in this direction. So this is how you do the this is how you do the posterior approach. Now if you talk about the lateral approach, if you divide the acromion into three parts, you will do this injection from the posterior third, the most posterior third part. And the reason is, if you can see the shoulder here, the space here is very little. So if you go directly here, you will struggle because the space here is really tight because humerus head is there. Now if you see here, the space is still slightly open, and when you are doing the lateral approach, you, instead of a centimeter, you go slightly more down, roughly couple of centimeters down, roughly here, and then you are aiming the center of the acromion. So if you divide that into two, if you aim in this direction, if you go your needle in this direction, that will be the appropriate direction. If you stay too close, then you will struggle to find the space. My preferred approach is posterior approach because that's what I am trained for. But if you want to use lateral approach, many studies have shown it to be superior than the posterior approach. So in terms of mixture, what I give, my cocktail contains of 40 milligram of depomedron. So roughly a ml of depomedron, and I take around 3 to 4 mils of 1 or 2% lignocaine. Now this part is already cleared or cleaned with alcoholic solution, so this is all sterile. Now the technique for injection is pretty easy. I just give it a shake because I have prepared it for a long period of time. So just aiming in the soft spot, remembering where my coracoid is. So my coracoid is here. So if you want, you can give local anesthetic. I don't, because I find if you prick the skin, you give pain, and if your technique is good, you don't need to give local anesthetic injection. So just underneath the soft spot, aiming towards the acromion, and just underneath so the patient does feel some discomfort, but usually not. If you're in the right space, this should go very, very easily. So you can see it's flowing really easily. And if you can see my direction, it's aiming towards the coracoid. So Varun, if you can just move your camera and just show the direction, it's slightly at an angle. It's not directly in the front. So this is the injection done for supraspinatus impingement through posterior approach. So in the same patient, if I had to do the lateral approach, I have just taken the needle off. I just want to demonstrate. I will be coming couple of centimeters down, and I will be aiming up towards the center of the acromion. This is what the direction will be. So once the injection is done, you just put a small sterile dressing, and that's your subacromial injection done for supraspinatus impingement through